Hello, everyone. Thank you so much for tuning in today to another one of our webinars. I really appreciate the fact that you are here and learning some more about a really fun topic today, PDO threads. So hi, Beth. Hi, Brenda. Oh my gosh, thank you guys all so much for joining us. So I just want to take just 1 second to just really encourage you to consider some self-care. And even if it's not in our office or dermatology, please, please, please do something for yourself. I just came into the office last weekend and my beautiful and wonderful PA, Emily, did the Fraxel on me last weekend. So I'm red and puffy, you might see, and she Fraxeled my face and my neck. I just want to say I feel so great. Just feeling like I'm doing something that will improve myself during this pandemic time and this just crazy time in our lives right now, I guess, 2021. So with that, let's go ahead and get started. So today we are talking about PDO threads. And we're going to be doing a live demo of Heather, one of our marketers. And Heather has been wanting threads for a long time, so she's very happy and excited. Okay, let me just present you the special so you have a little time to think about it, because these are only good until the end of the day. And these are also limited to the first 10 people to purchase. And that's because we have a really awesome promo. And I just want to give a little shout out to MERS, the makers of Radius, because they're helping to support us with this promo. This is really awesome, guys. You can do a thread lift. So you can choose, for instance, your lower face, or you can choose your neck. So it's for one area, neck or lower face, around the eyes or around the mouth. The cost is $1,500. We will also give you, at no additional charge, a syringe of Radius, and that will enhance the results we get. So thread lifts go hand in hand with filler, and the filler will help enhance the thread lifts and vice versa. So this is really awesome. This is going to help you get the best results. And so if you're on the fence about this, I want you to just think about it, because this is a great deal, and you'll save a lot of money. You'll save like half the cost of the normal, or I guess a third of the cost of the normal procedure. All right, well, you guys know I'm passionate about cosmetics, and I also want to ask you, why choose threads? Why choose threads? Do you want to feel rejuvenated and look rejuvenated? Do you want to improve your skin over the long term, improve the skin tone, texture, and tightness? Do you want to look more awake but have it look completely natural and soft and subtle? That's why you would choose threads. And it's non-surgical. Okay, so what are threads? The threads that I use are made up of a substance called PDO. That stands for polydioxanone. And the threads have been used for years with surgical applications. They are found to be safe for use in the body, and they're naturally absorbed. So they are absorbed by your body over 3 to 6 months. In this case, the brand of threads I use, I find personally they tend to stay for more like 6 months. Now, this is really cool. As the body breaks them down, there's more blood flow to the area, and also the process of breaking down the thread causes the body to lay down new collagen. So first you get the instant results from the threads, then you get new collagen of your own that will be long lasting as the threads are broken down. So it's really, really cool. The threads that I'm using are made in Italy. They are what I believe to be very high quality. At the time I added this to my practice, the only other options were threads made in China, I believe. Now I'm sure there's other options, but I really like the fact that the quality was there. And so these threads were FDA cleared for cosmetic use in May of 2016. And we have lots of different options. We can treat on the face and we can treat off the face. Now, when people come in to see me, most of the time they're asking me about their jowls and or their neck. So we can do either one of those or both, as well as other areas around the eyes, for instance. So you just numb with a cream. We do have laughing gas, and that device is called Pronox. So it's laughing gas just as you need it. It's not like going to the dentist. It's just if you're feeling a little bit anxious or worried about the procedure, you literally just ask for the laughing gas, take a couple breaths, and it just makes you feel a little more relaxed. We cleanse your skin with a surgical cleanser, and then we make out a plan. And then we use a combination, usually of barbed and smooth threads. So barbed, imagine these teeny little barbs on a thread. Those are really gonna lift. Those are gonna redistribute the skin. So take where gravity has pushed it down by the jaw and put it back up where it used to be, but do so in a natural looking manner. And then the smooth threads, they look like a little tiny fishing wire or fishing line, that is. And so they're teeny tiny, they're smooth. Those guys add support, they improve texture. So a lot of times I put those in the quote crepey areas. And as those are broken down, it's gonna make the skin look a lot smoother. So by the way, threads are great for patients who do not want to add a lot of volume to their face. So a lot of patients are coming in, they're saying, I don't want to look overfilled. I hate that puffy look. This is a great option for patients who are very worried about looking too puffy. So with threads, we lift without adding volume. And then this Radiesse I mentioned, as well as a product called Sculptra, both of those products can actually help improve our results with the threads, and they work really great hand in hand together. So sometimes I will do one or two of these before the procedure, just depending on how thick the skin is, how sun damaged the skin is. And sometimes we'll do it with the threads, sometimes we'll do it after the threads. But that's why we really wanted to offer you the Radiesse with the threads today, because again, that's just going to get you a better result. Okay, so here's just a select before and afters, a select few before and afters. So on your right, this patient's left, you can see that I have done a partial thread lift there. You can see her cheeks are rounder and more defined. The jowls are less on her lower face. Even what we call the marionette line, the line near her mouth, looks better, even though there's no filler in there. So you can see this patient has a beautiful full face. And so she doesn't really need volume, she just needs lift. And so so she just sat up real quick and we literally just snapped this photo. This is a very quick photo, but I love looking at this because it's really fun to see one side compared to the other. Here's a patient. Again, this is not the best quality of picture because sometimes we just get so excited we use the patient's phone to take pictures. So again, this is not our normal standard of photo, but this patient was very, very happy with her results. The before is on your left, the after is on your right. You can see the results are super natural. It's just that the cheeks are lifted. The bottom of the face is lifted and more defined and more structured. And patients love this because again, people can't put their finger on it. They just look like they did 5 to 10 years ago, or they look like they've gotten the best sleep of their lives for 2 weeks. So it's a great, great, beautiful look. So here's another patient, and you can see she has a really nice result. If you look from left to right, you can see her face just looks better defined on the right-hand side. It looks more contoured. It doesn't just look like it's flat. So you can see where her cheeks are. You can see her jawline is more defined. You can see her, what we call the nasolabial folds, the creases near the nose and the marionettes. They look better. They look more natural and lifted. So I just love this technique for patients of all ages. Okay, here's an example of a neck. Necks can be difficult because gravity is really working against us, both with the face and the neck together. But this was after one treatment, and patient was thrilled. This is, fairly quickly after the treatment. So she continued to get great results over time, and she told me that this procedure changed the texture of her skin. And it's been several years, I believe, off the top of my head, since her procedure. I think we might have done, some filler, but we haven't even repeated the thread lift as of yet, because she feels like she doesn't need it yet. Okay, again, threads of the face and the lower face and the neck. While she still has some lines, remember, this is not a facelift, and these are not facelift results. Again, this patient was very pleased with the results she had from a fairly easy procedure and one that's very, very, very safe. All right, for all of you guys, hi Donna, hi Tony. For all of you guys who are on the webinar, you're all going to be automatically entered into a raffle prize. And so we're going to give you 1 syringe of Radius, and you can use that, absolutely. You do not have to be doing threads to use this product. Everyone can use this product. I love putting it in the chest area. I love putting it along the jawline. I have it in my own jawline to sharpen the jawline and pull back any jowls or pre-jowls. And it's a great product. And so everyone has a place we can put this product. So you all are going to be entered. And if you do happen to purchase the package, it's just, again, going to enhance your results, because now you have not 1, but 2 syringes, and we're going to get phenomenal results. Okay, so to take advantage of our webinar, click the link during this webinar, or you could call our office or email us. We have a new cosmetic phone number listed and a new cosmetic email, which is listed. And we are going to have you purchase by the end of the day. We can only accommodate 10 of these promos. So this deal will only be good until the end of the day. Thank you so much for attending this. It makes me so happy when patients tune in. We do put a lot of thought and planning into these webinars, and it just makes us so happy and fulfilled when others attend. So give us a moment. We are going to just get set up here. I'm going to put on my personal protective gear, and we're going to get set up for the demo. So we will see you in a moment. Okay, sure. Heather, do you want to talk about why you have wanted to do threads for a while now?
Absolutely. So I turned 48 this year, and I think it was the first time I noticed my jowls, for lack of a better term, but just this area of my face. I'm not ready for plastic surgery. I don't know if I'd ever want plastic surgery, but I was a little, miffed that this was happening. And then when I started researching more and more about threading and watching all of the beautiful results with Dr. LaTowsky and how happy her patients are, I told her, I said, it's okay, I want to try this. I think it would be a wonderful non-surgical option. So here I am.
Great. Awesome. Well, thank you. Okay, so we have her marked out. Do you want to show actually the audience the markings?
Yeah.
If you
Can you
can
see
turn your head. And we're just going to do the lower face today. So the area around her jawline, because she does not like the beginning of the jowls. And she is already so beautiful and barely has anything there. But of course, it's all about prevention.
Well, yeah, I do that and I can see it.
Okay, so other areas that we can do would be the neck. So here, and then I put threads in here. The area around the eyes, the area around the mouth, and we can even put some in the forehead. Again, it's not a surgical result, but we can lift the eyebrows and make the eyes look more awake. So,
and somebody asked if it was the first time. I've never done threading before. So yes, this is the first time.
Okay, great. Any other questions? I love questions. She's beautiful already. Oh my gosh, Diana, you are so beautiful yourself. And yes, she is. She's so gorgeous, but we're going to keep her that way. She'll probably never age. Okay, so Heather, I'm going to have you, can you scoot a little bit towards me? And I'm going to have you turn away from me. And Shoria, I'll use your assistance, please. And just pull him over there. All right, Heather, first one. So let's see. Right here. And push. All right, Heather, how you doing? Awesome, great. And by the way, we have already cleansed her face with HibaCleanse. It's a surgical soap. So she's already cleansed. We've got her hair pulled back. We've got her marked out. So she is all ready to go. Perfect. All
If you want her to do a bird's eye view or anything, she can use the camera.
right. Okay. Do you want to do a bird's eye view? Sure. All right. I'm just going to put the table down a little bit. Nice. Oops, I need another one, please.
Yeah.
I'm going to do 2 5s and a 9. Okay. All right, great. And then I'll do a 9. Okay, here we go again. I'm going to put a little bit of lidocaine in, and that helps with some of the sensation. So it can look a little bit intimidating. But Heather, how's it feeling?
I don't feel anything.
Awesome. And she wouldn't pull your leg. She would say something if she felt it. But putting the lidocaine in, we literally put it in 1 minute before we got started with the webinar. And just letting it sit that 10, 15 minutes makes a huge difference. Nonetheless, Heather, there might be spots that are sensitive. Don't be surprised if you feel a little pinch here or there. A lot of times it's just like one little area that kind of gives you a little zing. And then we'll do more 9s, please. All right. So you can see we don't even have to use too many threads. And I'm just going to pull up. Yep, I'm going to remove these, Heather. I feel a little weird coming out. There we go. Perfect. Great. Great. Perfect. All right. Just hold pressure here for a moment. There we go. How you doing, Heather?
Good.
Awesome. Okay, great. Now going on to her neck area. Okay, are there any other questions, Abby, from the audience?
Anne wants to know how many threads are used.
Well, it depends on the person and what we want to accomplish. Very good question. So far we've used 3 threads on Heather, and I'm going to put 3 more along her jawline. And then we're going to reassess. So like a lot of things we do, this is an art. But in general, this is pretty typical for what I will do for patients.
Deborah wants to know which is the most difficult place to do the threading.
Difficult. Well, in terms of the patient, I would say probably this area is pretty sensitive. The area around the ear tends to be pretty sensitive for patients. The neck, surprisingly, patients do not mind at all. So it's really cool that they're not really feeling it in that area. And that's kind of nice because sometimes I end up putting extra threads around the neck, just depending on what the patient needs.
Anita asked if there was any bruising.
There is risk of bruising, just like any injection. We are using needles, but there are many patients who don't bruise, or they might get like a little pinpoint bruise at the injection point. But if you decide to do it, you shouldn't do it before any event. You should kind of, be okay if there is any bruising. It's nice to be able to plan. All right. Okay. And then let's go ahead and do some smooths. How you doing, Heather?
Good.
Okay, I'm going to move your head a little bit.
Okay.
How's everything feeling?
So far, so good. It's not very numb, so.
It's very numb or not very
I'm
numb?
very numb.
Oh, okay. Quite smooth? Okay. So these are example of the little smooths. I don't know if you guys can appreciate this. Ooh, this is going to be hard for me to show you. Yeah, this might. I'll take another 5, please. You can see it's very fine. I'm trying to show you. I'm not sure if that's translating, but trachea, congruent sharps. It's really cool how small these are. And so a lot of times with these smooths, patients don't even feel them. And again, they're great for just like that area where you don't want volume, but you want to improve the creepiness. You doing okay here?
Mm-hmm.
Okay, another one. Okay, one more. So this is really nice because it's going to help. It's not going to give her any lift right away, but it's just going to help that skin texture. And then with the new collagen, it's going to look really tight as this thread is getting broken down. Okay. All right, I'll give these back to you.
There's a question if there could be any negative side effects.
Well, one of the downsides about threading is that this is my least favorite part about threading. I encourage you not to work out for 2 weeks. And so that's because if you don't get the threads enough time to settle, sometimes, not all the time, but sometimes there's like a rare side effect of the threads migrating, where it would migrate towards the top. Can I have an alcohol swab, please? It would migrate towards the top, and you might even be able to see the thread. And in that case, we just remove it. Not a big deal, but it's just kind of a bummer because we want the thread to stay in place. All right, easy as that.
Wow.
Pretty easy, right?
Mm-hmm.
Okay, let's see, grab a mirror and let's take a look. We're kind of putting myself on a spot here, but let's see if we can see any results right away. Go ahead and sit forward.
Wow. Yes.
I'm going to change position so I can take a look at you.
Mm-hmm.
Okay, what are you seeing, Heather?
I can see it right in here. It's just like a little more shape, more, I can see my cheekbone a little more, and then that area that I wanted to move up, it moved up a little bit.
Isn't that great?
Mm-hmm.
And then you compare it to the other side, and the other side looks like it's just
Down.
Mm-hmm. Exactly. Can you try to look at the camera
Yes.
so we can appreciate that?
I'm just going to tilt this back just the tiniest bit. I can see it so much more on the camera.
Oh,
too.
great.
It's like,
Yeah, so treated, untreated. So very easy procedure. Results will last. A lot of patients, I will say, let's maybe do a touch up in a year. A lot of times it's 18 months before patients want another, feel like they need, I should say, another treatment. And if we had Radiesse, we would just lift her cheek a little bit more here, put some along the jawline to pull a little bit tauter, and then maybe put a little bit right in here. So thank you guys so much for tuning in. We'll let you know about the raffle prize. We'll look to see if there's any questions that we can answer via email, and we'll go from there. Thank you so much.
thank you.
Bye.